Alright, so now this is actually trying to give us an overview or a look into the anatomy of bone as we're about to start talking about diseases of the bone. So I want to look at the normal anatomy so that if you acquire the knowledge of the normal, later when you see the abnormal, you can be able to know the abnormal. So look at epiphyseal and also metaphyseal blood supply to the bone. So first of all, you need to know what is epiphysis. I also need to know what is what metaphysis. You know, so epiphysis is this top of the bone. Metaphysis is what this little space here before you have the long part of the bone, which is known as the diaphysis. So these two places they have blood supply. So we're talking about the top here, epiphysis, and also the metaphysis, which is the blood supply is very important. So epiphysis and metaphyseal regions of the long bones are usually supplied, okay, by the arterial systems. So let's look at the epiphyseal blood supply first. You have what? Epiphyseal arteries. They enter near the joint capsule, okay? They form the periarticular vascular arcade. Function is to provide nutrition for that part of the bone. Childhood importance. So while the growth plate is open, epiphyseal vessels are the sole source of nutrition for growing cartilage. So clinical note, if there's any damage to that blood vessels that is supplying the epiphysis, it will cause epiphyseal osteonecrosis and growth disturbance. Child, person will not be able to what? Grow very well again. So metaphyseal blood supply is supplied by metaphyseal arteries. They are the branches of what? Neighboring systemic vessels. Function is to supply the highly active zones of bone growth and remodeling, okay, between the epiphysis and the diaphysis. I told you guys that the metaphysis is this region that is between this long part, which is known as diaphysis, and the top part, which is known as epiphysis. So I think that's what we got. So clinical notes, any infection there can, affect that place a lot. Do you understand? So integration of other systems, now have nutrient arteries coming in, it goes down to supply the long part as the diaphysis and also periosteal vessels. So clinical relevance is what? Growth plate vulnerability. So since epiphyseal vessels don't connect to the metaphyseal vessels until after growth plate closure, there's any childhood injury there, it disrupts the growth of the child. Infection risks is a common site for infections. So that's why we actually study this to build up knowledge to proceed to the next chapter.